Stomach issues. There may be a simple answer to your challenges. Blame it on your gut. That's right, because your gut actually has a huge impact on your overall health. And on today's show, we're going to talk a little bit about this, as well as discuss some gut related medical conditions and tips on how you can stay healthy, as well as answer your questions here on Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hello, and welcome to Ask the Doc, No Appointment Needed, the show where we answer your healthcare related questions. I'm Dr. Kamaljit Kaur, a double board certified primary care physician, and it's a pleasure to be here with you today. Today, we're talking about gut health, a really exciting topic. I know it may not seem so, but it is. So let's get right to it. Our first question comes to us from JoJo, and he writes, I was diagnosed with irritable bowel syndrome, and as you can imagine, it's causing me many issues. My sister told me she has inflammatory bowel disease. What is the difference between the two, and can either of them cause serious health issues? Hi, Jojo. Thank you for writing in. And it is such an important topic, and I'm so glad you asked it because there's a huge difference, similarities as well, but there are huge differences between irritable bowel syndrome, known as IBS, and inflammatory bowel disease, known as IBD. Now, we're going to talk a little bit about the similarities first, but I do want to point out that while irritable bowel syndrome, IBS, is a syndrome on its own, inflammatory bowel disease is a term that's used to describe an umbrella term used to describe a host of diseases, two of which are ulcerative colitis and Crohn's disease. And as the name suggests, these are very inflammatory conditions. So let's talk a little bit about those similarities. Now, even though there's real differences and some similarities, it's important that you know which one it is that you're dealing with, because inflammatory bowel disease, it can also affect you your whole life. It's once diagnosed, it's indefinite, as is irritable bowel disease. But with inflammatory bowel disease, you have a high risk of colon cancer. And if nothing else, that's the one thing that I want our viewers to realize and to learn about today. Now, when we talk about these similarities and differences, it might get a little bit confusing. So let's start with symptoms. You can have similar symptoms in both of them. So abdominal bloating, abdominal cramping, diarrhea, constipation, nausea. And while these may seem like non-specific symptoms, unfortunately, they are those that alert us to, hey, there's something going on in the gut that we really need to take a look at. Because like I said, these are lifelong conditions and they can really impact somebody's life in a negative manner. And obviously we want everybody to be healthy, right? So some of these symptoms may come one at a time, or they may come on all together. And there's really no rhyme or reason on how this happens. The other similarities between these two conditions is how they develop in the body. Now, while at the molecular level, it's different, we do know that both of them affect your gut-brain signaling pathway to some degree, one more than the other. There's also an alteration in the gut microbiome that promotes development of these diseases. And there may even be, and there is actually, especially for IBD, a genetic component as well. Now, whether or not you're going to develop either of these conditions obviously depends on a whole host of things, but those are the main points to highlight. So with these similarities, you can see why it's so hard to tell which one you actually have. You might feel a little bloated, and you might feel a little constipated or nauseous or have some diarrhea. And maybe at first you don't think anything of it. But if this continues, then really needs to be determined whether this is a condition known as irritable bowel syndrome or is it inflammatory bowel disease, because the treatment for those is very different. So let's talk about those differences. Now, some of the differences between inflammatory bowel disease and irritable bowel syndrome are in the name. Inflammatory bowel disease promotes inflammation in the intestinal tract and even in parts of your body outside of the intestinal tract, like your eyes. It could also, your mouth, you could have ulcers in the mouth as well. So that's something that's very important. But like I said a little bit earlier, inflammatory bowel disease has a high risk of colon cancer development, which IBS or irritable bowel syndrome does not have. Also, unlike IBS, IBD can create issues in other parts of your body, like I mentioned. So you can have inflammation in the eye, it's called uveitis. You can have aphthous ulcers develop in the mouth. And then also in other parts of even the GI tract itself outside of the intestine. So, like your gallbladder can be afflicted as well. Now, you may remember that in previous episodes, we've mentioned and talked about the gut microbiome and its relationship with the immune system. And even though we're still researching, exactly what that is and exactly what it means to get some solid answers, we do know that IBD is a kind of autoimmune condition, or it has an autoimmune component to it, whereas IBS does not. Now, IBD, like I mentioned, is a type of autoimmune disease, and it can cause physical damage to the digestive tract. And actually does cause inflammation and damage to the digestive tract, but how much is caused really depends on a whole host of factors and how early in the disease process you catch it. Remember, for any disease, the earlier you catch it, the earlier you treat it, and the healthier you can be, and you can prevent it from getting worse. Now, IBS is a functional disorder. So I keep saying IBD is an inflammatory disorder. What about IBS? Well, that's more functional. And that is kind of confusing sometimes, not only for the patient, but for the doctors as well, because there's really no blood test or, anything that we can see on a CAT scan or colonoscopy that would make us say, oh, hey, that's a marker of IBS. That's what this person has. Instead, IBS is what we call a diagnosis of exclusion. So when a person comes in saying, hey, doc, I'm not feeling so great. I feel bloated all the time. I'm constipated or I have diarrhea, any kind of GI issues that are different than what your norm is, that prompts us to say, okay, we got to figure this out. Which disease process is it? And usually, if we can't figure it out with some simple blood tests, we go for a colonoscopy. And on that colonoscopy, if we don't see anything, there's nothing on the blood test, and we are pretty sure that there's nothing too sinister going on, then we diagnose the patient as having irritable bowel syndrome. But with IBD, inflammatory bowel disease, there are distinct blood markers that you can test for, and there's distinct findings on colonoscopies and sometimes even CAT scans that we see. This is all due to that inflammation that it causes in the body. Now, the IBS or irritable bowel syndrome usually is a diagnosis, as I mentioned, of exclusion, but also that pattern of symptoms that people have or that they say that they have. And those symptoms may not go away on their own or they're not alleviated with simple treatments. So let's talk about the treatments. Now, according to the American Gastroenterological Association, treating IBS really focuses on supportive therapy. So, say your IBS is constipation predominant, because you can have constipation predominant or diarrhea predominant, or unfortunately, even mixed IBS. And we're going to want to treat those symptoms and to alleviate them. So, in order to do that, we might prescribe anti-diarrhea medications or anti-constipation medications. You may also experience a lot of cramping with IBS, and we prescribe medications that target and aim to reduce that cramping that happens in the stomach and the GI tract. The IBS that we often forget or overlook to discuss with patients is the mental health component of it. Surprisingly, IBS does have a pretty impactful connection to our mental health. And because of that, sometimes the regimen of treatment that we prescribe for IBS includes psychological treatments or therapies, or cognitive behavioral therapy is also another one of them, but it's all connected. So in order to get the best treatment for IBS, it's really a well-rounded approach that we want to go by. IBD, on the other hand, you might have guessed, because it's inflammatory, the treatments are aimed at reducing that inflammation. And this can be done with medications known as immunosuppressants, biologics, steroids reduce inflammation as well. So that's another medication that can be given. And the main goal with IBD is to reduce the amount of inflammation that's present in the gut and prevent it from getting worse. Because if that inflammation continues, runs rampant, and goes unchecked, it promotes an environment in the gut that leads to the development of cancer. And that is something that we absolutely want to prevent as much as we can, especially with the increased amount of colorectal cancers that we're seeing in younger individuals in the United States now, the higher incidence of IBD that we're seeing, that also in younger patients. So because we are seeing these things happen more, we really want the viewers and we want everybody to be more cognizant of them. So the moment you feel something is off, you go get checked out right away, you get treatment right away, and then you can prevent all the complications from happening. So I hope this helps answer your question, and I hope that this helps to explain a little bit about the differences and similarities between two commonly known conditions. Let's move on. The next question comes to us from AJ, and AJ has emailed us asking, I'm 43 years old and I have a history of colon cancer in my family. I've got a typical middle-aged man gut. Is there a relationship between my gut and colorectal cancer? When should I start thinking about getting a colonoscopy? AJ, thank you for writing in. This is a really important question. And with you having a family history of colon cancer or colorectal cancer, I'm so glad that you're being vigilant and you really want to know what to do to keep yourself healthy and to get screened. But before I delve a little bit more into your question, let's watch this video from our friends at the CDC.
Talking about colorectal cancer is probably not at the top of your list, but it's super important. So let's get straight to the point and answer some common questions. So, what is colorectal cancer? The straight answer is that when cancer starts in the colon or rectum, it is called colorectal cancer. Sometimes it's called colon cancer for short. Why is screening important? Sometimes abnormal growths, called polyps, form in the colon or rectum. Over time, some polyps may turn into cancer. Screening tests can find polyps so they can be removed before turning into cancer. Screening also helps find colorectal cancer at an early stage when treatment works best. Who should get screened for colorectal cancer? That'd be everyone 45 and older, so tell your friends. And what should you do if you've got any more colon cues? Keep it simple and start the conversation about screening options with your doctor today. Want even more facts? Visit cdc.gov/screenforlife to learn more.
That was such great information. And I am so glad that they differentiated that sometimes it's called colorectal cancer and sometimes it's called colon cancer, because I think people might get confused, but it is essentially the same family of diseases that we're talking about. Now, back to your question. While it is really, really important to know your family history and to know what diseases run in your family, when it comes to colorectal cancer especially, it's important to know who in the family had the disease. For instance, if you had a first-degree relative, so a mom, dad, or a sibling that had colon cancer, that's significantly going to impact your risk of developing the cancer, versus if you had a great aunt that had it, but nobody else in the family had it. And the reason I say that is because we have guidelines. And as the video mentioned, the guidelines recommend screening for colon cancer in an average risk individual at age 45. Now, what is average risk, you may ask? Average risk is an individual who doesn't have a personal or family history of colon cancer, who doesn't have any other conditions that increase their risk of colon cancer, and doesn't have any other types of cancer in their body. So for an average risk individual, man or woman, 45 is the age for starting screening. But if you have a family history, especially in a first-degree relative, so a mom, dad, or sibling, if any of them have colon cancer, then you want to start getting diagnosed at least 10 years before they were diagnosed. So for instance, if your mother was diagnosed with colon cancer at age 50, then you want to start getting screened at age 40. So a little earlier than the general guidelines, because you're not average risk anymore, you're at a little bit of a higher risk. Now, this is important also to talk to your doctor about, because if you have any other health conditions, then you want to make sure that those are being addressed as far as assessing your overall risk. And I'm so glad that you asked about a colonoscopy and you went right to the target, because there are non-invasive ways of testing. So Cologuard, the home stool test, and those are important, but those are usually reserved for low or average risk individuals. Now, in someone with a family history, especially a first degree relative with colon cancer, you want to go straight for colonoscopy because you're at a little bit of a higher risk. And those other tests, which are done at home or non-invasive, even though they're great and they're more advanced now than they were, say, 10 years ago, they still have the risk of false negatives. And we don't want to have a false sense of reassurance. We want to know for sure, especially if you're high risk. Now, regarding the relationship between fat accumulation around the gut and colorectal cancer, well, there is a scientifically proven clear-cut association between the two. Visceral fat tissue. What is visceral fat tissue? So the fat that accumulates in your abdomen usually really actually goes around your organs. It just likes to wrap around those vital organs, your liver, your intestines, your kidneys. This is known as visceral fat. And studies have shown that this visceral fat, more than any other fat in your body, say the fat in your legs or the fat in your arms, more than any other fat in the body, this is very, very inflammatory. And we all know anything that promotes inflammation in the body is going to lead down a track that can be quite unhealthy. And the other thing that it promotes is the formation of micro mechanisms in the body that create an environment in which cancer will flourish, or the cancer causing mechanisms will flourish. So as you can see, it's really, really important to maintain a healthy diet, a healthy weight, to exercise, all those good healthy lifestyle measures that we talk about often, to help reduce the inflammation and reduce your risk of cancer, which is so, so important. Let's get to the next question. This one comes to us from Robin, and Robin writes, I'm curious, my allergies and my asthma have gotten really bad lately. This conversation has me thinking, is it external weather conditions, or could there be a connection to my gut health? Hi, Robin. You're not alone. I've been relying a lot more on my antihistamines lately, especially with all the weather changes that we're experiencing. Now, while external weather conditions can certainly do it, it's important to note that your gut health can also contribute to your allergies. In fact, if you hear me sniffling this morning, that's my allergies kicking out. So the gut microbiome affects the immune system in a lot of ways. But one of the ways is that it promotes your tolerance to dietary triggers and to environmental triggers, allergens, and antigens, as we call them, through different mechanisms of the immune system that lives in our gut. Something that would take a whole science lecture to explain. But the point is that your gut microbiome really helps to strengthen that immune barrier that lives in your gut. And it reduces the potential for the intruders and these allergens and the things that cause us to sniffle and sneeze during allergy season to really, make that into full force. That in turn can certainly trigger your asthma. Now, if you're somebody who's dealt with asthma for majority of your life, you know that asthma can be triggered by a lot of things: cigarette smoke, smoke in the air from wildfires, or even a really rainy day, extra pollen, maybe a cat walks by. So sometimes pretty much anything can set off your allergies, and then that in turn can set off your asthma. So there certainly is a connection there, and your gut health is for sure contributing. So as always, be sure to eat healthy and eat the foods that are going to promote a good and healthy gut microbiome so you can reduce that inflammation, and so your gut immune system is nice and strong and it keeps out all those intruders. These are great questions, and I love that you're sending them in. But if you haven't had the opportunity to send them in just yet, here's how you can still do it.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question comes to us from Felix, and he has a very important question, and I'm so glad he sent this in. Felix asks, I've been very depressed lately, and it seems to be getting worse. I read somewhere that there could be a connection between gut health and brain neurotransmitters. Am I on to something here? What can I do to overcome my latest bout with depression? Thank you for reaching out, Felix. This is a certainly very, very important topic, and I certainly want to try to answer it and help you out. But before I do that, I want to encourage you to talk to your primary care physician or your therapist or psychologist and let them know what's going on. anytime we have any mental health conditions, whether it's anxiety or depression or bipolar disorder, we want to make sure that they're well controlled because just like blood pressure or diabetes or IBS or IBD, they have the potential of getting worse and really having a negative impact on our health. So please, please do reach out to your physician, your therapist, or your psychologist and let them know what's going on because it may be easy to just to fix it or to help alleviate it and prevent it from getting worse. Now, yes, you are certainly onto something here. Did you know that some experts have found that your gut, your intestinal area, may have more neurons than even your spine? I mean, when I found that out, I was pretty surprised. I don't know about you, but if that's true, then it's no wonder that when you're anxious or you're not feeling well, that your gut gets affected and vice versa. Just like with our immune system and other items that we've talked about, our mood is certainly linked to our gut health. And some studies have shown that individuals who have depression have less of the good bacteria in their gut. So with your gut microbiome, you have a whole host of microorganisms, bacteria, viruses, fungi, and a lot of them are good. Yeah, you may not believe it, and it's hard to understand sometimes, but we do have good microorganisms, and their job is to help us stay healthy. They can secrete certain substances, they help us fight infections, they help keep the bad microorganisms out. So yes, good and bad microorganisms. And in depression, we have seen a lower count of those good microorganisms in those people's guts. Now, one of the main mechanisms here at play, just like with a lot of the other things we've talked about today, is inflammation. And the reduction or increase of it really, really impacts your mood and it impacts your neurons as well. And this is seen not just in depression, but in other mental health conditions as well. In addition, we've seen that eating good bacteria and gut promoting foods can certainly help improve mood as well. Now, studies are still being done, but we've seen that sometimes taking probiotics helps as well. So I know that's something that a lot of physicians and therapists are starting to recommend now. And to the other side of things, I want you to also consider what you can do in addition to diet, exercise. Exercise is probably the most underutilized drug that we have, to be honest with you. And it's a very natural medicine, and it certainly helps promote the formation of those good bacteria, but it also has a very positive effect on your neurotransmitters and dopamine. So you want to keep that in mind as well. In fact, did you know that some studies have shown that exercise can be more equal to or more effective than even medications for depression and anxiety. So please do take that into account. Now, no matter what the reason is, it's certainly beneficial to live an overall healthy lifestyle, not only for our physical well-being, but also our mental health and our mental well-being. I hope this answers your question, Felix. And again, I want to encourage you to reach out to your primary care physician or to your therapist and really let them know what's going on so they can get you feeling better quickly and soon, hopefully. All right, next question is from Antonio, and he reached out to us via Facebook asking, my mother has been struggling mentally and her cognitive decline keeps getting worse. Her doctor said she is showing signs of Parkinson's. I recently read that there can be a connection with gut health here as well. My question, is there anything we can do in relation to her gut health that can help slow the onset of Parkinson's disease? Hi, Antonio. I'm so sorry to hear that your mother is going through this. I can imagine how difficult it is for you as well, because we see our parents as pillars of strength, as rocks of the family. So to see them vulnerable is heartbreaking sometimes. But I'm glad she has you in her corner and there to support her and to look out for her. As we talked about a little earlier, gut health is important for so many reasons, but certainly for the brain as well and cognitive function. Did you know that the good bacteria in our gut can help promote this by releasing what are called short chain fatty acids? Now, these are great for many reasons, but promoting the health of your nervous system is probably one of the best things that they do. On the flip side, a bad gut microbiome can negatively impact our cognitive health, our mental health, and overall brain function as well. It can also limit the capacity of critical thinking skills, and it can promote conditions like Parkinson's, either in their development or in making them worse if a person already has them. And last, but certainly not least, some studies have revealed that certain bad bacteria can actually break down the medications that are prescribed for Parkinson's, and then that makes them ineffective. So, on one hand, you might be being prescribed the right medications, but if you have a bad gut microbiome that's messing with those meds, then it may not even be, doing anything in the body. So as you can see, that gut and brain health signaling pathway and relationship is really, really close. And so it's important to make sure that you're healthy on all ends. And it would be great also that incorporating some lifestyle measures for your mom. So some supervised exercise, a healthy diet, reducing her stress, and making sure she's getting enough sleep at night. These are all things that are going to be healthy and help her Parkinson's, in addition to the medications that her neurologist might prescribe her. But as always, do talk to her neurologist about this to get some really personalized information for her, so that we know that whatever she's doing is going to be in her best interest. These were some wonderful questions, and I think we've talked a lot about the gut and gut microbiome and gut health and diseases today. Keep your questions coming. We're so happy that you send them in. I'll see you here next time on Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.